The mainstream health system has massively downplayed the importance of vitamin D, yet almost every system in your body can go haywire or completely break down without it. The result? Millions of people worldwide suffer from health issues that are not only serious but also completely preventable, from high blood pressure and depression to much worse. Shockingly, more than 1 billion people around the world are vitamin D deficient. And here's the real tragedy. Most never truly recover from that deficiency, even if they try. Why? Because many spend most of their lives indoors, avoiding the sun, and are told to take far less vitamin D than their bodies actually need. In today's video, we're going to uncover 6 serious hidden risks of low vitamin D in older adults that doctors don't mention. And after that, I'll show you exactly how to take vitamin D the right way, so you can tell if you've been taking far too little or dangerously too much. Before we dive in, please hit that like button and subscribe to the channel. It helps this video reach more people who desperately need this information. Now, without further ado, let's get started. 1. Silent immune system breakdown. One of the most dangerous and least talked about effects of low vitamin D is what I call silent immune system breakdown. It doesn't happen overnight. Instead, your immune defenses quietly weaken in the background, leaving you vulnerable to infections and illnesses that your body used to fight off easily. Vitamin D isn't just a bone vitamin. It's actually a critical immune regulator. Your immune cells, including T cells and macrophages, have vitamin D receptors. When vitamin D levels drop, these cells become sluggish, less responsive, and sometimes fail to activate properly. That means your body's first line of defense against viruses, bacteria, and even abnormal cells is compromised. A 2017 review in Frontiers in Immunology found that vitamin D plays a key role in activating the immune system's killer T cells, which seek and destroy pathogens. Without adequate vitamin D, these cells can remain in an inactive state, allowing infections to take hold more easily. The consequences can be subtle at first. You might notice you catch colds more often, need longer recovery times, or develop lingering coughs and low-grade fevers that just won't go away. Over time, the risk escalates to more serious infections like pneumonia, shingles, or urinary tract infections, illnesses that can be life-threatening in older adults. It can feel like your body is aging faster than it should, you're more fatigued, every little infection knocks you down harder, and it takes longer and longer to bounce back. For many, this is misattributed to just getting older, when in reality it's an avoidable deficiency quietly sabotaging your immunity. To make matters worse, several studies, including a 2020 meta-analysis in Nutrients, have linked vitamin D deficiency with increased severity of respiratory illnesses, including influenza and COVID-19. In other words, low vitamin D doesn't just make you more likely to get sick, it can make the sickness far more dangerous. 2. Increased risk of sudden falls. Another hidden, and often life-altering danger of low vitamin D in older adults is the dramatically higher risk of sudden falls. And we're not talking about clumsiness. This is about a deficiency that quietly weakens the very systems that keep you standing. Inside your muscles, vitamin D helps regulate calcium flow, which is essential for muscle contraction. When levels are low, your muscles become weaker and slower to respond. The result? You might lose your footing more easily, stumble over small obstacles, or even feel your legs give out unexpectedly. A landmark study published in the Journal of the American Geriatric Society found that older adults with low vitamin D were up to 70% more likely to experience a fall than those with healthy levels. Another randomized controlled trial in Osteoporosis International showed that vitamin D supplementation significantly reduced fall risk in older populations, not by magic but by improving. The danger here is twofold. First, falls can cause serious injuries like hip fractures, which often trigger a downward spiral of reduced mobility, loss of independence, and even increased mortality risk. Second, the fear of falling again can lead people to move less, which accelerates muscle loss and balance decline, creating a vicious cycle. It can feel like you're just getting shaky with age, but in reality, this is often a nutritional problem, not an inevitable part of aging. 3. Increased risk of autoimmune flare-ups. The next silent but devastating danger of vitamin D deficiency in older adults is its ability to fuel autoimmune flare-ups. Sudden, painful, and often unpredictable surges in conditions like rheumatoid arthritis, lupus, multiple sclerosis, and even inflammatory bowel disease. Vitamin D is not just a vitamin, it's a potent immune system modulator. Think of it as the traffic controller for your immune system, helping it decide when to attack harmful invaders and when to stand down. Without enough vitamin D, This control weakens, and the immune system can become confused, sometimes turning its weapons on the body's own healthy tissues. Research published in Autoimmunity Reviews has shown that low vitamin D levels are strongly associated with higher disease activity in autoimmune disorders. Another study in Annals of the Rheumatic Diseases found that patients with rheumatoid arthritis who were deficient in vitamin D experienced more frequent and more severe flare-ups, along with higher markers of inflammation in their blood. The consequences can be brutal: sudden joint swelling and stiffness, extreme fatigue, nerve pain, or digestive distress, often striking without warning and lasting for days or weeks. And because vitamin D deficiency is rarely tested during routine checkups, many people have no idea that a simple correction could reduce the intensity or frequency of these flare-ups. For older adults, these immune storms can be even more dangerous. Prolonged inflammation accelerates tissue damage, speeds up joint degeneration, and can even increase the risk of cardiovascular disease, all while drastically reducing quality of life. 4. Chronic fatigue and low mood. Did you know that low vitamin D can leave you feeling like your body and mind are stuck in permanent slow motion? This isn't just feeling tired, it's a deep, dragging fatigue that lingers no matter how much you rest, often accompanied by irritability, brain fog, and a persistent low mood. Vitamin D plays a key role in regulating the production of serotonin and dopamine, neurotransmitters that control mood, motivation, and mental clarity. When your vitamin D levels drop, your brain chemistry shifts in a way that can mimic depression, seasonal affective disorder, or even chronic fatigue syndrome. A large study published in the Journal of Clinical Endocrinology and Metabolism found that older adults with low vitamin D levels were significantly more likely to report fatigue and depressive symptoms, even after adjusting for other health conditions. Another randomized controlled trial in psychiatry research showed that vitamin D supplementation improved mood and reduced fatigue in people who were deficient. The consequence? You may start skipping social activities, exercising less, and withdrawing from things you used to enjoy, which only worsens both your mental and physical health. For many older adults, this cycle is misdiagnosed as just aging or normal mood changes, when in reality, it's a nutritional issue that's both preventable and reversible. It can feel like you're carrying an invisible weight every single day, with no idea that something as simple as restoring your vitamin D levels could help lift it. 5. Accelerated cognitive decline. Most people think memory loss and slower thinking are just part of getting older. But in many cases, low vitamin D is quietly speeding up the process, damaging brain health years before a dementia diagnosis is ever made. Vitamin D is not just for bones, it's a neuroprotective hormone. It helps regulate calcium in the brain, supports the growth and survival of neurons, and reduces harmful inflammation that can damage brain cells. When vitamin D levels are low, the brain becomes more vulnerable to oxidative stress and the buildup of abnormal proteins linked to Alzheimer's disease. Here's where it gets even more alarming. High blood sugar, particularly in diabetes, is a well-known driver of cognitive decline, so much so that Alzheimer's disease is often referred to as type 3 diabetes. Chronically elevated blood sugar damages blood vessels in the brain, impairs nerve function, and fuels inflammation, all of which accelerate dementia. And this is where vitamin D plays a critical role. Low vitamin D is strongly linked to insulin resistance, the underlying problem in type 2 diabetes. Without adequate vitamin D levels, your body's ability to move glucose from your bloodstream into your cells becomes impaired, leading to persistently high blood sugar. Over time, this not only raises your risk of diabetes but also dramatically increases your chances of developing dementia. The evidence is strong. A 2022 study in Alzheimer's and dementia found that people with low vitamin D levels had a 60% higher risk of developing dementia compared to those with adequate levels. For older adults, the impact can start subtly, forgetting names more often, losing track of appointments, struggling to find words, or feeling mentally slower than before. 6. Hidden cardiovascular issues. Low vitamin D doesn't just affect your bones or mood, it can quietly strain your heart and blood vessels in ways that may go unnoticed until it's too late. Vitamin D helps regulate blood pressure, calcium balance in the arteries, and inflammation within the cardiovascular system. When levels drop, blood pressure often rises, arteries stiffen, and inflammation increases, all of which set the stage for heart disease. Research published in the Journal of the American College of Cardiology found that people with low vitamin D levels had a significantly higher risk of heart attacks, heart failure, and strokes, even when controlling for other risk factors. Another study in hypertension showed that deficiency can activate the renin-angiotensin-aldosterone system, RAS, a hormonal pathway that directly raises blood pressure and damages blood vessels. And here's where it gets more concerning. Low vitamin D is also linked to insulin resistance and chronic inflammation, both major contributors to metabolic syndrome, a cluster of conditions that drastically increases the risk of cardiovascular disease. For older adults, this can feel like episodes of unexplained fatigue, shortness of breath when walking, or occasional chest tightness, symptoms that are often dismissed as just getting older when in fact they could be early warning signs of vitamin D-linked heart strain. Now that we've covered the dangers of low vitamin D, let's talk about what the science actually says about getting your levels up, and why the standard advice is often nowhere near enough. The official RDA for vitamin D in most countries sits around 600 to 800 IU per day. But here's the problem. Multiple studies have shown that this amount is laughably low. In fact, it's not enough to even maintain healthy blood levels in most people, let alone reverse a deficiency. A paper in the Journal of Clinical Endocrinology and Metabolism found that doses under 1,000 IU daily often failed to raise blood vitamin D into the optimal range, even after months of supplementation. Newer research is now pointing to much higher requirements, especially for seniors. Many experts suggest 2,000 to 4,000 IU per day just to maintain adequate levels. And if you're already deficient, which many older adults are, you may need 5,000 to 10,000 IU daily for several months until your blood levels recover. Some people, under medical supervision, even take 20,000 to 30,000 IU per day without issues, but when taking D3 always pair it with the appropriate amount of K2. For every 1,000 IU of vitamin D3, you should also take 10 micrograms of vitamin K2 in the MK7 form. Vitamin K2 directs calcium into your bones where it belongs and keeps it out of your arteries, reducing the risk of dangerous calcification. And there's one more piece of the puzzle: magnesium. Without magnesium, your body can't properly activate vitamin D. Aim for 300 to 400 milligrams daily from highly absorbable forms like magnesium glycinate or magnesium malate. These three nutrients, vitamin D3, K2, and magnesium, work synergistically to protect your bones, heart, brain, and immune system. Of course, don't start any supplement regimen without talking to your healthcare provider first, especially if you're on medications or have chronic health conditions. As you have seen, vitamin D deficiency is far more than a bone health issue. It's a silent disruptor that can affect your heart, brain, immune system, and overall quality of life. The good news? With the right approach, you can take control and protect your health. If you found this video helpful, please give it a like, subscribe to the channel, and turn on notifications so you never miss future videos. Thanks for watching, and see you in the next one.